Then for the last presentation, I turn to Mariam. Are you going to share your screen? And this is now for us to really inspect the setup of the data that we are going to be producing. Over to you.
Thank you, Prof. Mariam. So I'll just share my screen. Can you see my screen now? Yeah. Okay, so within the current architecture, we have template groups, and we have 7 template groups in total. And within each template group, we have template 0, we have COVID-19 generic templates, the MCH generic templates, and also the outpatient register. And the outpatient register was basically created basing on the data that is collected within the facilities, along with the COVID and the MCH generic templates. Well, you may notice that there's a number of, let me say, colors on the overview. The green basically represents the fields that satisfy the KPIs. And well, the KPIs are what was used to, well, I'll just show them just a bit. These KPIs are currently the queries that are done in the current architecture were based on these KPIs, which are then displayed on the dashboard, like Olwale presented. And well, on the first KPI, we have like the number of patients visits. The second is on admissions, discharge, and frequency of selected diseases. We were able to work around. Some of the KPIs were not available in some of the outpatient registers. For instance, the OPD register, which is used to collect outpatient data within the facility, does not basically capture the admission or the discharge field. But we were able to, within the other templates, the Nigerian, Kenyan, Somalian, the NA basically stands for not available. And then these KPIs were specific for the maternal child health generic template and the COVID-19 template. So like I mentioned before, the ones in the green are the fields that are satisfying the KPIs that are currently being displayed on the VODAN dashboard. And these fields also have well, descendant terms. So during Ridwan's presentation, if you noticed, there's the component that is used to generate the data, which is also connected to an ontology service. And the ontology service is what contains our control terms that we are using within VODAN. I could also show a bit of our, this is the VODAN portal, and it basically comprises of all the terms that are used within the VODAN community. And within each ontology, we have the ontology, and then we have the branch, which then has descendant terms. And this is just a basic illustration of the the descendant terms under each tree, basically. And I think I've basically covered everything that I needed to show for my presentation. In case anyone has questions, feel free to ask now. Yeah.
Great presentation, Mariam. I think, I don't know what others feel, but I think we've been treated on 3 excellent presentations that clarify so much. Tesfit.
Thank you, Prof. Good afternoon, everybody. I just have 2 questions regarding the MCH register that is listed and the KPI concept that we are mentioning here. When it comes to maternal and child health, it's a vast service, and I think when it comes to Ethiopia, for example, it consists services related to ANC, PNC, delivery, and other similar maternal and child health services. So the data that is collected is not something that is coming from one register or one template. I was looking to the Excel sheet, and the details, items, or variables that are stipulated and listed out there are not something that a single health professional feels or collects. So I mean, it should be cleared out somehow that are we going to specify the department, for example, delivery or ANC service that we are going to collect, or we are going to address all maternal and child health service? If so, we might need some other architecture or human resources or point of data collections. And the second question is the issue of KPI. I think KPI is key performance indicator. So what we are collecting is something that is a representation of a specific variable. Whereas when we say KPI, for example, we can think of top 10 diseases, for example, for Ethiopia or for Zimbabwe. So such kind of matrix is called KPI. Whereas what we are doing here is listing a disease or portraying a given variable. So I'm afraid if we are going to align somehow the things that we aggregate with the concept of HMIS, as we are planning to integrate it with the HMIS or with the DHIS software. Thank you. Over to you.
Well, thank you for that, for the question. And this is actually a relevant point. We were actually discussing this last week, the fact that different facilities actually have different MCH templates. Also keep in mind that the CIDR system is actually flexible, and you're able to create any kind of templates with different fields. And basically what would happen would then be able to create the different ontologies that are suitable for those specific templates as well. So I don't really find that an issue, but for the analysis, for this analysis, we used a generic template for all the countries, and this is just a VODAN generic MCH template. It's not that this is what is actually used. If you notice, I indicated on here that it's a generic template. But we can always customize according to what's within the facilities, like what we did for the outpatient registers. That's absolutely not a problem. And then with the KPIs, yes, as you can see, we have the KPIs are listed here. There's the frequency of selected diseases as well, like you mentioned. So these are just the templates attributes within the specific templates, and then along with their descendants terms. Does that answer your question?
Yeah, Mariam, I think I have got your point, but what I was trying to explain is, for example, I was looking to the Ethiopian MCH variables or the template attributes. Is it really going to be implementable in our case? For example, we are going to provide a single computer and going to collect a data from a single point of service, whereas those things that are listed here are something that we are going to collect from multiple wings. So I was kind of checking the reality on ground and what we are trying to list here. For example, in the Ethiopian case, those attributes are somehow attributes of delivery and ANC and other maternal and child health services. So I don't know for the other countries, but I was just taking the Ethiopia's list of attributes. So that's why, but your explanation is well taken. Thank you.
Oh, thank you. That's most definitely going to be put into account for the next bit of the deployment, and that's why we're actually having some future steps that have been already mentioned, also by Prof. Mariam, and yeah.
Yeah, these are very relevant discussions. And Mariam, thank you for doing all that work to make it now so clear and allows us to ask these questions.